Indigenous Australia's is one of the oldest living cultures in the world. Unfortunately, Aboriginal Torres Strait Islander culture is often misinterpreted or misunderstood. It's really important that culture is just not seen as a barrier to effective healthcare, but it's seen as a powerful enabler. I think if people understand the culture, the people that healthcare is provided for, there'll be better health outcomes. In Rheumatic Heart Disease Australia, our mission is to walk alongside Aboriginal and Torres Strait Islander people. I think you can only really walk alongside Aboriginal people if you really understand who they are, understand the social, the environmental, the political factors that they live and die in. This is very, very important for us at Rheumatic Heart Disease Australia. We've embedded culture, the first time I think that it's ever been embedded in clinical guidelines. So we have the evidence-based guidelines and we have culture that sits alongside it. And culture is seen across the whole guidelines. Culture is very important. The lived experience of those that have got acute rheumatic fever and rheumatic heart disease is very important. So understanding somebody's culture, understanding the circumstances in which they live is really important. Too often we send our young ones off to have valve surgery, and unfortunately we put them back into circumstances that really acute rheumatic fever loves. So we don't look at that person holistically. We know that Aboriginal health is built on a holistic concept, the mind, the body, the spirit, and bringing on top of that is the culture. So what are the cultural components of care is very, very important. And often culture will explain or debunk some of the myths around people not wanting to stay on track. They're non-compliant is a word that we often use. But if you understand somebody's circumstances, if you understand their health beliefs, which is driven by culture, you can have a better understanding of why Aboriginal people fail to seek medical attention, sometimes scared to go into hospitals. And often through that transition period, we might see them when they're transitioning from a child to adult fall off treatment. So there's a lot of cultural nuances or cultural underpinnings that can explain interactions with health services. In particular, the third edition of the guidelines really shows what are the cultural implications of good care of acute rheumatic fever and rheumatic heart disease.